My name is Trip Stone. My training background is in emergency medicine and internal medicine, and I work in both of those capacities here in the hospital. So I treat patients in our emergency department, and then also on the floor, I do my internal medicine there. Case management is an invaluable part of our team. I rely on them a lot to help with patient follow-up appointments, keeping track with other physician offices, getting records. So one of the helpful aspects of case management is to make sure that we're serving our patients best. Oftentimes I may want to admit a patient to our OBS unit or maybe an inpatient unit just to monitor them, check labs in the morning, vital signs, and so on. But in the patient's best interest, if it's relatively low acuity, the case managers will help me use certain criteria that, hey, they may not meet inpatient metrics or criteria to have it covered by insurance. That way the patient is not doesn't get a large bill that they were not previously expecting because insurance companies didn't want to cover it. So that's very helpful for us to allow for our patients to not have surprise charges. One of my favorite aspects of case management is their follow-up calls. They are very good about calling patients that have either been discharged from the floor or discharged from the emergency department. They will call them the following day, see how they're doing. They often assist me with perhaps bringing the patient back for repeat labs or just to touch base. If I'm seeing a chart overnight that I wanted to switch antibiotics on a patient that was seen by one of our nurse practitioners, case management often helps me call those prescriptions in and checks on the patient. So that is one of my favorite aspects of them, just because they provide that extra safety net for me. So again, kind of to dovetail with how case management helps me with patient designation in terms of do they qualify for inpatient observation and so on. They help with transitions of care as well. So oftentimes patients will come into our observation unit and then they will subsequently need to be transitioned to inpatient, or they've been on the inpatient service for a while and now physical therapy deems that they need a swing bed admission for prolonged physical therapy, and case management helps guide that. Unfortunately, in most, I would imagine most physician training programs, the insurance aspect is not our focus, and case management helps me navigate that system. One of the nice aspects of this hospital and with how we've designed our or how we round is that case management is always with us when we round. So if there are outpatient appointments or labs or just any additional service that the patient may need, case management is a really helpful tool to figure out what they need and to help schedule them for a lot of our transition of care to home. An additional aspect of one of the great services that case management provides is for patients that may not have insurance or have trouble securing funding. They have a good understanding of local resources, within the community, charity things of that nature, and then also to help patients get insurance or apply for insurance and apply to get established with physicians that may take their insurance and so on. So that's also a very helpful aspect. Very pleased with our case managers here and the program and services they provide. Like I've mentioned before, they're an invaluable asset to our team. They take care of so many things that one makes me feel more comfortable with patients going home and with follow-up services and so on. That would just really be a burden to me during the day while I'm trying to engage with patient care. When you're solo coverage at a small critical access hospital, case management is really, really a valuable tool.